I may go with a 15. I've got an option here. I planned it for a 15 initially, and then I kind of looked at it, but I'm going to try a 13 and see if I engage enough bone with a 13. And if I don't, I may go to a 15. But like I said, I like to be a little bit conservative around the bicuspid, lower bicuspid region. So our motor, let me just show you the motor here, and I know you've seen it outside there before, but so the motor, it flickers on camera. I don't know if that's what you're seeing. Is it flickering up there?
Yes.
That's just because of the video signal, but the motor has 3 settings. You've got we've got 6 settings, but number 1, it says pilot drill. Number 2 is start implant torque test. Number 3 is your final implant placement. So we're going to start with number 1, and we're going to do our pilot drill. Okay?
Can you reverse with the motor?
You can. Number 4 is a reverse button. Okay, open for me. So we have the surgical stent in place. Let me see if I can adjust her a little bit so that you can see a little bit better. Now the green surgical stent denotes a CT guided stent, and the clear ones are the regular non-CT guided stents. Okay? So Jenna will hold the stent in place while I make my pilot hole.
Is that the silver?
Yep, silver drill guide, 1.2 millimeter pilot drill.
And you go up and down with the pilot drill?
One time, and I'm going to go back in here. I want to just see. Yep. Okay, suction. I drilled a little bit deeper after taking the drill guide out because it was a little bit soft, and I know I took the tooth out about 6 months ago, didn't we?
A year ago, probably.
Almost a year ago? I think I'm going to go with a 15 millimeter because the bone seemed a little bit soft. I want to try to engage as much of the bone as I can. So I'm going to go ahead and put the stent back in. And here's the drill, the implant in the vial. And we're going to go ahead and take the carrier and pull the implant right off like that. So we never touch the implant at all, okay? And you can see we can turn the implant upside down and it won't fall out of the driver. I'm going to go right to the patient's mouth.
That beak, was that the foot pedal changing the setting?
Exactly. We go all the way down until it snaps right off of the implant. And there's the implant in place part way, okay? Now we take the stent out and we're going to place it the rest of the way. Any pain at all? Okay. And we have a little beeping sound which indicates we've reached 30 Newton centimeters of torque, which is the minimal torque that we want to load the implant immediately. Now I'm going to try the crown on now and see if I need to place it any deeper. And I think we're good right here. Bite together. Perfect. Open. The lingual side, as you can see, is right down to the gum line. The buccal side is to the gum line. I'm going to just give it one little turn with a ratchet wrench. And we're done. Ready to cement the crown. Any questions about that? Hold the lip. Wasn't quite down all the way.
Yes, we have a question.
Yep. What do you mean? No, it was in the direction of the stent. The stent was angled purposely a little to the lingual. Now I'm putting the cement in the crown and a little bit of cement on the implant itself. We're going to go ahead and sandwich the two together. Go ahead and bite together. And we're just going to have her bite together, open, and bite for about 5 minutes.
Why do you have the patient bite on a gauze?
Just to hold the tooth in place. Just a thin gauze, just one layer, just to hold it still. Because otherwise she could move it around with her tongue a little bit. This will hold it still. We'll have her bite, total of 5 minutes. We'll have her bite for about 1.5 minutes right now, and then I'll take it out and clean the cement off, and then we'll have her bite again for the next 3 or 4 minutes.
What is the cement like with a minute in hand?
It goes through a rubbery stage, which makes it very easy to peel off. In the rubbery stage.
Have you ever had a crown come off when you were taking off the cement or glossing it?
If you wait the 90 seconds, you shouldn't have any problem at all. And then you clean the excess cement off, and then wait another 3 or 4 minutes, and you should be fine. The only time you run into an issue is if for some reason it's a new tube of cement, and if you don't dispense a little bit out of the tube before you put the mixing tip on, sometimes one side's loaded a little more than the other, and you get more catalyst or more base, and you don't get an equal mix. So when you first open a tube, take the cap, just make sure you squirt a little bit out like that so you see it both coming out of both tubes. Just wipe it off, and then you'll put your mixing tip on. You all right? Okay, open.
Dr. Shatkin, on your impressions for your restoration,
Keep biting for another minute or so.
using a full arch impression, or can you use just a triple tray followed by a single?
Yeah, for single teeth and even up to two or three teeth, occasionally you can use a triple tray. Definitely for single teeth and 2 teeth, you can use a triple tray impression. I like the triple trays a lot. If you want, for four or more units, you should definitely do like a full arch impression. Maybe 3 units, you could do a quadrant impression, but with a separate bite. What happened? How long ago? Hi.
Do you ever have your assistants trim the cement and then you double check it?
They always clean my cement for me, but since I'm here, I'm doing it. Open. They do a better job than me cleaning cement. So we're getting the excess cement off now. There really isn't much. Turn your head toward me a little bit. A little bit on the inside. Cement's pretty much set now. We cleaned some of the excess off. Just gonna floss. Nice contacts. Go right up underneath the crown, up to the implant itself, on both the mesial and the distal. Contacts are perfect. Bite together, checking the bite. Bite together again, hold it. Checking the bite, open. Bite together. The bite looks perfect. Open again. And I always like to tap on these.
How important is it to check the lateral function when you're checking the bite?
We check everything. Bite together. Slide your jaw to the right and left. She's got a big cuspid rise. She's got no issues there at all. So she's in good shape. So we now have how many implants? 4, 8, 9, 10, 11, 12 implants in her mouth. And 100% success. Let me just see something here. I did her original implants. I'll leave the light on for a minute. I did the original, keep your head back, honey. I did the original implants, let's see, in 2011, we did the upper right side. So that's 5 years ago. We did this side 5 years ago. We did the lower right side implant also in 2011, this tooth here, which is doing great. We did, let's see, the upper left side in 2014 up here, and now we're doing this one. So she's doing very well, and I think if you guys are really nice to her, she'll come upstairs and say hello to everybody. All right. Any questions at all?
Yeah. Everybody's on this. Really good.
Hi.
I have payment. You do? Payments. How was it?
You want to take shots or want me to get the exit?
Nice job. How was your trip?
I don't go anywhere.
Oh, I thought you were away.
No.
Were you away? Okay, guys. Can you pull that up? What do you think? 15 minutes? What's the problem? It's not working? You gotta get a wire right up here so that this doesn't happen.
Your computer doesn't have an input.
Well, you gotta figure that out. You can do it. Use a different computer. Here's that implant. Here's the nerve canal down here, so we're plenty of distance away from the nerve. Here it is in the patient's mouth.
One of the doctors had a question about why it was angled toward the lingual.
You try to angle the implants in the direction of the lingual cortical plate. Pretty much, you engage good bone that way. If you look, I'll show you the one behind it, which is also angled in the same exact manner that I did back in 2013 or 11 or something.
Are you less likely to be in the way of the nerve when you go?
Yeah, exactly. So here's the one behind it. Same direction. So this is the one I did, I think, in 2011, right here.
Bicortical stabilization.
Yeah, and it is. And here's the one we just did now.
Do you ever worry about perfing that lingual plate?
Not if we're using a CT stent, I don't, because it's angled exactly where we want it. So that's where it is now. So we're perfect on that, and that's why I was debating using a 13 or a 15, but I ended up going with the 15, and I'm comfortable with that. So, all right. So the next case, Jerry, you want to pull up the next case? Where did he go?
I'll go get it.
Where's Jeremy? He just walked out of here.
Yeah.
He just ran down the stairs. He said, Dr. Shatkin will chase him. He gets nervous about CT.
We got to pull up the next case. Are there any questions about this one? That one like clockwork, right? 15 minutes.
If you didn't have your CT scan, that's where you rely on good impressions because you.
Yeah, I would have done the same thing without a CT scan, and you would have worked out just the same. Because all the other ones I did before I used CT, they work out fine. Why do you need a CT? It's getting to be standard of care. We're getting closer to that point where it's a standard of care is to have a cone beam X-ray when you're doing implants. And I've been using cone beam in my office since 2009, I believe. And there are certain times where you absolutely have to have it. There are other times where you can get away without it, but I take one on every new patient. Yeah.
Do you also see the CT afterwards, or?
Yeah, this is the afterwards.
But if you
Every-
have a class, you still would do it.
I take a post-op the day of the procedure. We double check everything. Yep. Yep.
Are you able to get the finished crown in a better position using the CT?
I believe the whole thing ends up being a little bit smoother. A little bit.
Help you with it.
Can you get the next patient's x-rays up here?
Yes, sir.
Thank you. But it's freezing for some reason right now. The next case was an overdenture. Patient, we'd put in 4 implants, immediate extraction, 4 implants for an overdenture. And I put the implants where I could find bone at the time of the extractions. So one of the implants is quite angled lingually just because that's where the bone was. We are converting that patient over to a roundhouse bridge by adding, I believe, 6 or 8 additional implants now. And that's what we're going to be doing next. I have a roundhouse resin bridge that we're going to deliver today and use it kind of as a trial. If everything looks great, then we'll take our final impressions and make our final zirconia bridge in the near future. But right today we're putting a nice roundhouse resin bridge that Valdi made in the lab, and and we have a CT guided stent to place the additional 6 or 8 implants. So hopefully we'll get that X-ray up here. Are you working on that? Oh, he's doing it up there. Let's see.
Dr. Shatkin, you have a question?
May not have taken one.
Shatkin, there's a question back here.
Yeah, we may have taken it on the iCat before we installed this machine, Jeremy. I don't know if you can hear me. Yeah.
One of the things that attracted me to your system and never let me learn conventional implants, and to this day I've never done a conventional implant, was when I came for the training. Was it?
Yes, Dr. Shatkin, I found the X-ray. You just have to give me it.
Is it on the iCat or on here?
It is on the iCat.
Okay, thank you. All right.
It was a very simple system. One drill, that's it. And you had been doing it for 5 years by the time we met, and you said
Yeah.
you were 500 at that time. You know. Now, this time I see a lot of more steps and more implants, and I feel like, I get anxiety that, okay, if I change to this, I don't.
Well, just keep with what you're doing.
Okay.
Use it.
My question is that why changes? I mean, it was so simple.
I use the 2.0s and 2.5s 90% of the time. Joe's the one that likes to use the 3.0s.
They're real good.
Oh, there you are. But I've been using the smaller diameters since 1999, and I like them, and I still use primarily 2.0s and 2.5s. But there are dentists that want a 3.0. There are dentists that want a one-piece, so we have them available for you.
And there was no 2.9 back then, but once NDI started making 2.9, I started placing them, and I had failures with 2.9.
Yeah, I like the smaller ones. And come on in, Debbie. This is our patient, Debbie. Where's the handheld mic? Do you have it? Handheld microphone?
Yeah.
Deb, want to say a few words to our group of dentists here?
Okay.
The nicest thing about Debbie is every time she comes to my office, she brings us treats. Sometimes she makes them in her kitchen. Sometimes she buys them. So yesterday we had cookies, I think, that she made. And today she brought a huge box of donuts, and she's adding to my belly. But we love you. Here, say a few words. Hold the mic up to your mouth. No, just tell them about your experience. We've done a bunch of implants on you, and hold the mic. Hold the mic up. Tell them the story.
When I was young, I had many problems with teeth. Drilled, re-drilled, filled, refilled. Then it goes to the point that you're pulled out, or you get partials in that, and they move around, and then you can pop it in and out, and the whole 9 yards. And when I came to Dr. Todd, he put them in. It's like a miracle, these things. I don't know why people even do root canals. Take the tooth out, put the implant in. No, seriously, it's a pain. You know, you got all that pain. You got to keep going back. You come here, he drills it in, puts that thing in. Never had a problem with them. They all fit great. And even when he puts them in, they're perfect. He doesn't even have to file them down or anything. It's like, you know how you go to the dentist and, oh, it doesn't fit right. You got to file them. These things fit like perfect.
How would you describe that appointment today? How much discomfort did you have?
I had nothing. Even the shot wasn't bad. Usually the worst part of it is the shot. And the implant, I felt it when, as soon as he said it had to go down with a beep or something, you can feel a little pressure, and it stops. There's no pain. This will be fine. I was ready to eat donuts. Not on that side though. But I probably won't even bother me. It ain't gonna move. You know. So.
Thank you.
You're welcome.
Thanks, Deb.
You're welcome.
We'll see you next week.
I'm gonna have to go downstairs to adjust it.
Enjoy your trip here.
I can't adjust it here.
You're gonna have a difficult time.
Let me give it a try. Can we make it bigger? Okay, click on the.
No.
Why? What just happened?
Well, that's what I said.
I didn't do that. I didn't even touch it. Put a dedicated computer up here with a wire.
Everybody can still hear you.
I know. I don't care.
I know.
I've told you that before. All right, go downstairs, and I'll go downstairs and adjust it. All right, and then I'll come back up. Okay, can you hear me up there?
Yes, we can.
I'm not going to come back up. I'm going to just go ahead and get started here. Good morning. What a nice looking orange face we got here. We'll get that all cleaned up for you.
You're now blonde
All right.
hair.
My wife, we could only have an ice cream party.
I'm going to take your glasses off, okay? I'll put them right over here. Is that okay?
Sure.
I know people get a little crazy with their glasses, but... So we have 4 implants in place right now that were placed at the time we took teeth out, correct?
Yes.
And he had a tough time getting used to the denture. He wanted something more permanent. So today we're going to be adding implants. Where is your denture? You have it with you?
In my pocket. I didn't button it up.
So here's the immediate denture that we had with the little bit of blood in there. But here's the immediate denture that he had, and it snaps on pretty nicely. And it's stable, and it has a palate cut out of it. But he wanted something more permanent that he didn't have to take out of his mouth. So we had the lab make a roundhouse resin bridge as an immediate at the time we placed the implants. Bite together. So I'm just trying this in. Turn this way a little bit. Bite in the back. The bite needs a little adjustment. Yeah. Okay, let me adjust the bite a little bit on this on this resin bridge first before we start. Looks really nice though, really nice. I just gotta take a little off the lingual here. Close again. We have some more paper, some articulating paper. Horseshoe's good. Bite again. Bite. Bite. Hold it. Open. Couple spots, just minor adjustments here. Bite again. How's that feel? Pretty good? Open. Bite. Hold it. Hold it. Open. Hold it again. Open. We're getting pretty good occlusion there. See. Bite together. Open. Yeah, it's solid though.
Yeah, I know. I can keep it.
We'll leave it for now. I was thinking about removing this one implant that's angled lingually, but it's very solid, so we'll leave it for now. And we're going to go ahead and he's all numb, right? Dr. John already anesthetized him, so I'm going to try the surgical stent in. So what we did is we built the new CT guided stent around the existing implants. You guys can come closer and get some masks on. Get one for her too. Where is she?
She just
Okay, so we're gonna go ahead and hold that in place. Can you tell me what size we requested here? Okay. All right, so 1, 2, 3. Okay. The first two implants we're going to use are 11. You see, when we send you the paperwork, let's see if I can show you this here. It's a little hard to see. It shows you this.
Try angling it just a little bit, it might show up. No, the other way.
Oh,
That may work.
it shows you the implant sizes.
You could bring it up and pass it around or something like that.
I'm just cleaning the lens a little bit. Let's see. It tells you the implant. Let me just adjust the brightness. It might be better. There you go. So it shows you the implant sizes based on the implant location 1 through 9. They don't always go in order. There's sometimes it depends on how I place the planning of the implant. It goes in the order of where we place the implants in the machine, in the computer, but they're all labeled. So see, this is number 1 through 5 over here, and then 6 through 9 over here. So we're planning to place 9 additional implants in addition to the ones that are already in place. That's the plan, okay? We'll see how that goes. Yes?
Do you ever have to cut a CT splint because it might not be totally parallel?
Occasionally. Occasionally we have to cut it. Did you numb all this, Johnny? Palatal?
I believe so.
Give him palatal and okay.
I give it palatal, nasal palatine and then that block.
All right. I think we're going to end up adding 8 implants, not 9, but we'll see here. Hold that for me. I'm going to go ahead and use my silver pilot drill. So here are the 3 pilot drill guide instruments. You have the silver, the yellow or gold, and then the blue one. Okay? You see that?
And those are the ones that are labeled on the side so that you know that they're designed to be used as a CT.
Yeah, so this one says a 1.5 millimeter. This one's harder to read, but it says 2.0 or 1.2, and then this one says the 2.0. Okay. So we're going to use the 1.5 or the silver one for the 2.5 implants. I'm going to start back here with 11 millimeter. You hold that real tight, okay?
Any reason for starting in the back?
I'm going to just go hold this for me. I'm just going to hold this for me, please. Leah, hold this, please. I'm just going to go 1 through 9. I'm just going to work my way around so I put the right implants in the right spots. So we're starting with the number 1, which is an 11.5 implant. First hole, hold it still. Second hole. This is the one that we're gonna, okay. Third hole. So I got 3 holes made. Yeah, the first 2 are 11s. Yep.
If you were doing this with a conventional splint and not a CT guided one, would you also drill the 3 holes all at the same time, or would you do one and then put it in front of the end of it?
It's really up to you. You can do 1, 2, or 3, whatever you want. I'm putting the first implant in place. Get a mask on here. There's the first implant in place.
Can we get a little more close up on that?
I'm trying to do it. Just give me a second here.
All right.
Trying to do it. I know I'm trying to. I screwed it up. I lost the image. Hang on.
And 3.
Hang on, I just lost the.
Jeremy, can you get down there and help him?
I don't remember which is. Hang on a second, we'll get it. Oh, darn it. There.
There you go.
It's not zooming in though. The zoom's not working for some reason. I'm sorry. Let's see. I don't know why. Something's wrong with the zoom. I don't know. It's the first time I've tried it and it's not working. Anyway, we're going to go ahead and take the stent out. I think you can see pretty well though. I'm going to bury that implant the rest of the way.
When you're coming down to the last few turns and one side of the polished tower is up and the other side is actually...
Doesn't matter.
Doesn't matter, thank you.
The image is up, but the zoom isn't working for some reason. Do you have any idea why?
It's one of those buttons on the floor there.
It's not though. It's not. The two buttons that do the zooming are not working.
The levers in front of the lens are manual zoom.
You want me to do that?
Where? They don't work either. I checked it. It's not working. The zoom is broken. We got to check it. So I'm going ahead and placing the next implant. We have 2 implants in now. Here we put the stent back in. We're going to make our next, we made our next hole. We're going to use a 13 millimeter implant now in the third hole because that's what the CT stent prescribes. Is it in? We have a mirror. Now let go for a second. Hold on. Make sure you have it in the right spot, Leah.
No pain?
Okay. Let's make the next 2 holes.
Dr. Shatkin, can you show us how much play you have with the drill guide and the new CT guided stent?
There's very little play. We've made the tolerance very tight. The next ones are 15s. So the next 2 implants are going to be 15 millimeter by 2.5. I don't like the way that one angled. I'm going to go ahead and do the next one. What?
They might use this for number 6. I don't know.
What's that? Oh, yes, we got 15s. What are you talking about? Okay. It's okay, I don't care. This is not in good bone. This bone is a little bit soft here. I'm going to take this one back out for a minute. Suction there. Keep suctioning, please. Well, I may or may not take it out, but right now let me focus on what I'm doing here, okay? Let's get this in. Keep suctioning, please. Don't worry about it. Let me just get the implants in. I understand what you're saying. Just want to get suction back there. Where's that implant? Okay. Trying to find bone in this one spot. It's a little bit tricky. Let me try this on here. So I try to bridge on after placing a few of the implants. Make sure it's still in the same spot. Here, that's okay. Just hang on. Bite together. The bite's still the same and it's still seating all the way. Open. Nice thing about a temporary bridge at this point is we could always relieve the inside of the temporary if we need to a little bit. This implant ended up being a little bit more buccal than the plan was, so I'm going to take this instrument, I'm just going to bend this implant a little bit into the lingual, and I'm taking the ratchet driver, putting my finger right on the top of the ratchet, and I'm using my thumb over here to bend the implant a little bit. And it's a little more in line now with the other implants. Okay. I still think this will probably go on just fine because I think I bent it right into where I wanted it to be. Yep. Okay. So now we're going to go ahead and place our next implant, and like Dr. John mentioned, we may end up having to cut the stent because as you get more and more implants on, it gets a little harder to place the stent back on and off. This is a 15, I believe, right?
And
Similar to the procedure we did when we were down in your office. We got this one almost in all the way. And that just beeped, so that's good. We have 9 implants total so far. I'm going to go ahead and put the last few in there. 3. Last 3 implants to go. And those last 3 will be 8, 7, 8, and 9 11 millimeter implants. 3 11 millimeter implants.
Is this going to be a cemented cake or?
This is gonna be cemented. It's gonna be a cemented bridge. We're gonna cement the temporary in. Cement is temporary and with temporary cement, and then. You felt that a little? You feel a little bit?
Yeah, no.
Okay. And one more. Can we get it? You got it?
Yep, now I got it.
Hang on. Hang on. This one's not in bone yet. Let me. Nope.
Okay, thank you.
This one implant didn't hold in the bone, so I may skip that one. These are okay. Turn your head toward me. Yeah, the bone's a little soft right here. Tissue's flabby. So we're going to skip that one location. Suction, please. All right, so we've placed, I believe, 7 implants. 1, 2, 3, 4, 5, 6, 7, or 5, 6, 7. They're all nice and solid. Let me try the bridge on. Now you can ask your question. Whoever had a question, I'm sorry I interrupted you.
Is that more bleeding than normal?
No, this is pretty normal. Bite together. There's almost no bleeding. Open. Bite together. He had a drop on the right side because I angled it a little off. Let me see. Have some articulating paper. Horseshoe. Bite. Open. He has a little bleeding from this one hole where I placed a hole and didn't place an implant because we have one here and I decided not to place one. That's the only spot that's bleeding right there. And a little bit over here where we tried that one. just going to hollow out the temporary a tiny bit. Oh, sorry. You okay? Was there another question? I think somebody had a question earlier. Oh, to remove the implant that's osseointegrated, we would first try to reverse torque it and see if we can get it to unscrew from the bone. And if that didn't work, I mean, we have two options. We could surgically remove it, we could cut it at the gum line and leave it, or we could leave it in place and not take it out at all. Most likely I'm just going to leave it in place because it's strong and it's doing fine. Hang on a second, I can't hear you, I'm in the other room. Okay. I'm good. I'm good. I'm good. Okay, what was that?
Would you ever consider bending it more towards the center of the restoration?
Yeah, I could, but it really won't help because of the angle that it's in. Okay, bite together. Turn this way for me. Bite together. Turn this way. Turn your head. It's hitting a little on the left side here. Open. Bite. Open.
What cement are you going to use if you're planning on doing this over again?
What do you mean? Oh, temp cement, Telio. Bite together. Bite. Bite and hold it. Hold it together. Open. Give me a new piece. Bite. Open. Bite again. Okay, we're pretty good. I'm just going to do a little adjustment. Open for me. Little adjustment of the bite. You okay? Just going to polish it up and then we'll cement it. All right. Okay, so we've adjusted the bite. We're polished the bridge up with some pumice, and I'm ready to cement. What are you laughing about? Huh? What? Is this light off? Get my other. Yeah, not really. Yeah, I did. Okay. Bite together. Perfect. Open.
No, I got that.
You've got the.
Oh, do you want housing then or healing?
No. Nope. John?
Yes.
Should we take the final impression before we cement the temp?
No, I think we should do the time and then see how it goes, and then maybe later down the road take final impression. You might want to.
Yeah, put some shims on there. Then we'll reline it and then we'll make then we'll cement each hole.
Excellent.
Was a question?
Yeah, on a case like this where you know you're just putting in a temporary, would you ever consider doing
Now
that
this-
with O-ring housings?
Now the Zoom's working. You could use O-ring housings. What I'm going to do is put shims on, because we didn't make enough room in the temp for O-ring housings in this case, especially with that one implant that's quite lingual. So I'm going to put shims on all of those, and then I'm going to do a reline. I'm going to reline the bridge with resin reline Luxatemp material. And then we'll just put a little bit of cement in each hole, a little bit of temporary cement in each hole to hold it in place. Because we basically we troughed out the bottom of the bridge, see? I don't know if you can see that, maybe it's too bright. Let's see. Okay.
Doing great, Steve.
So we troughed out underneath the bridge. And we're going to reline that. I'm going to let Dr. John take over here and do a little bit of his magic. I've done my part. Any other questions?
No question.
I'll give you the microphone here.
Hey, Dr. Todd.
Yes, sir.
Thank you.
You happy?
Oh, happy.
Everything went real. Everything. Say it again.
Happy, happy.
Happy, happy.
Happy.
Happy, happy. Everything went real well. We're just gonna figure temporary on, okay?
Thank you.
So reline it and then take the shims out and put all temporaries.
Good idea.
Okay.
I gotta.
You're on the microphone.
Good afternoon, everyone. Or good morning, actually. Feels like afternoon. So we're putting shims on so it doesn't get any, we'll be able to take this off easily. I'm going to try it in again. Put your teeth together, please. Thank you. Just a little bit. Okay, open, please. Feels pretty good. Okay. We're losing Luxotap.
You want to lay down?
Yeah, that'd be nice.
I didn't put too much in there. Close again, please. Checking the bite. Everything looks pretty good. We might have to do some more occlusal adjustments. Open. Close then.
Now hold this for
Okay, we're going to hold that for about a few minutes.
the top one.
Yeah. The light?
No, the camera?
Yeah, it's on.
You're on the camera.
Okay.
Camera's on. But the light's not on there.
There you go.
There it goes.
Okay, let's take this off. All right, we're in the time to take this off.
Was the light on before?
And this is what we were looking at.
We'll take the shims out.
Now we're going to take the shims out and trim this up. So please take the shims off, please. Okay, so your shims off. There's a couple shims that were inside the temporary bridge. So we're going to go ahead and cement this temporarily. And then what we could do as time goes on in a week or so, we could start adding a little bit, making more of an opaque like Dr. Joe was talking about, and get the gum tissue where we want it. So we're going to add temper cement. We use Telio. It's pretty strong stuff. I'm going to try fit this in before. Make sure everything is okay. Put your teeth together. Good. Okay, we're going to cement this in. Let me just check the bite one more time here. Bite down, tap, tap, tap. Side to side. Okay, a little rocky, I don't like that. You get some good bites, but I'm going to take off some of the cusp area, or the lingual incline of the buccal cusp. Just to prevent, I don't like too much rocking. Thank you. Okay, tap, tap, tap. Side to side. A little bit less, okay. Close again. Right there, open. Sometimes doing the occlusal adjustments take longer than putting the implants in. Paper, thank you. Oh, see, open, please. Close. Tap, tap, tap. Side to side. Less rocking now. Open. Close again. Yeah, so you get a better bite. Okay, open. The dealio. You have to have fun doing dentistry. It's otherwise it's work. So I'm placing it in. This material you have to work pretty quick. And we just don't want to put too much in because we want to be able to get it off. Okay. And this material you have to be kind of fast. Close down again, please. Open. Bite down. Okay. And we'll wait for a few minutes for that. And we'll check the bite again. Welcome back. So let's just take a look at everything. My assistants did a good job of removing all the excess cement, but there shouldn't have been any excess cement because I just put a little bit in.
So you got it cemented now, Johnny?
Everything's cemented in. I'm just gonna check the bite again.
Bite looks pretty good.
Yeah, it's on biting on. Oh, don't close you. Hey, he's got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 contacts. Bite down. Okay.
It looks fine.
That's great. Let's take a picture of that. Okay, thank you.
Thank you. Joe, I'm going to have to interrupt you now.
No problem, Bill. We'll switch the screens over.
Yeah.
We got it going.
Thank you. Well, our next patient is Earl. Earl, say hi to the camera.
Hello.
This is Earl, and he can wave even. We're going to be trying his new bridge in today, and then hopefully putting in 12 implants and cementing his permanent teeth. So he's presently got a full upper plate. We'll take that out, and we've got a zirconia bridge made here. Just going to try that on. Go ahead and bite gently together. That looks fabulous. Let me get that image a little bit more this way. Smile real big for me. Looks really nice. So we get that straightened out a little bit. All right, now you can see it pretty nicely. It's a beautiful bridge, and it adapts to the tissue really, really nice. Color is perfect. Open for me. Look at the lingual side. I don't know if we can see the lingual side very well, but let's see if we can get...
Try the big mirror.
I can try the big mirror. Here's a big mirror. This is my April Fool's Day mirror. Don't swallow that. Jeepers. This is my April Fool's Day mirror. They gave me this on April Fool's Day a couple years ago. Came in, my first patient, they handed me this massive mirror. There we go. And it fits right along the gum line real nicely. Bite together. Open. And bite one more time. Okay? Open. So go ahead and clean them up, and then we're going to go ahead and... We also have a surgical guide stent made. CT guide stent made. We're going to put 12 implants in. The back one on each side are going to be 11s. The rest are going to be 15 millimeter length and a 13 millimeter length. 11.5. So two 11.5s. Some of these are also 2.0s. So we have four 15.2.0s. 4 15.2.5s, where the ridge is thinner. Let's see. Yeah, the ridge is a little bit thin in some areas. So I'm going to try the stent in. That fits nicely. Okay. We'll raise them up just a little bit and tip them back. Oopsie. Wrong button. Oh, jeez. I'm having trouble here adjusting this. Oops. Oh, I'm sorry. I'm pushing the wrong buttons. Trying to zoom the camera, and I'm putting the light. Now the zoom's working good. All right, so here's our you hold the stent for me? Marking stick. So we take a Thompson marking stick. I break it in portion of it off so that I can mark each location. Don't worry about that. I'll take the stent out, and you can see the locations, the approximate locations of where I'm going to place all the implants. And I'm happy with the plan there. Have a marking pen. What I'll do is I'll just take a marking pen and I'll just darken them a little bit.
He's going to check the bridge again and see where the marks are and compare it to the feel of bone. Just making sure it's right where he wants to be. Plus it's...
So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 spots. Okay? And those spots should line up very nicely with the 12 holes here in the bridge. You can see how beautiful that bridge is. The lab does a really, really nice job. And like I said before, it'll fit right up against the gum line. It'll look like it's coming right out of the tissue. Okay? Okay. So we're going to go ahead and get him numb. Little pinches, okay? Okay. Did great. Everybody has their own technique for anesthesia. I find that the quicker you do it, the less pain they have. You get in and out quick, and I think Septicaine also has less stinging than lidocaine, and it works quicker. So I use mostly Septicaine. So I'm going to go ahead and try the stent in, and you can hold that in place. So the last one on each side is going to be a 11.5 by 2.5, and that's where I'm going to start, and that'll help stabilize the surgical guide. Do it. Record it. More. That's easier. Just do it here. You're okay. I'm going to take that back out one more time. So we marked the locations for 12 implants. We have our surgical guide stent made. And we also have our final restoration all made in advance. And we've tried that in, and again, bite one more time. The bite's perfect. Chin down a little bit. Okay. Open. We're going to go ahead and put the surgical guide stent in place. He's been anesthetized with about 2 carps of Septicane. We're going to start with our most distal implant on the right side. Nikki's going to suction and she's going to hold the stent in place. You don't have that on. So go ahead and keep that stent real still. Made our first pilot hole, and we're going to go ahead and place the first 11.5 by 2.5 Shatkin interlock mini dental implant. And we're setting the motor to 30 Newton centimeters, 35 RPMs, which is the first torque test. Okay, suction. We're going to go ahead and make the next pilot hole on the left side. Yep.
Why do you do the first in the line?
Because I want to stabilize the surgical guide stent on both sides, so that then I can go ahead and do the difference in all the ones in between. My dad always taught me to divide and conquer. Okay, so now we have the stent in. I'm going to take the stent out and I'm going to place these implants the last few turns. Okay, section some of that where I'm working here. Okay, so we've got our first 2 implants in place. I'll go ahead and put the stent back in. Okay. And as long as we're doing this, let's do this. One thing I like to do is try the bridge on after every couple of implants to make sure there's been no change in the way it fits. So we'll go ahead and put it in now with the 2 implants in place. Go ahead and bite together. Everything fits the same. Okay. We'll go ahead and take it out. And we'll go ahead and put the next set of implants in. So at this point now I don't have to do one side or the other. I can just go ahead and work my way around. So we'll go to implant number 2. Is going to be a 2.0 by 15 implant. The ridge is getting a little thin in this area, so we're using 2.0. And what is the next one, Jenna? So the next 2 are going to be 15 2.0. So I made 2 holes. Now remember, this is not a provisional restoration. This is the final porcelain fused to zirconia bridge. That'll all be done in one visit.
Dr. Shatkin, just wondering, did you get 30 Newton centimeters on the first 2 implants?
We did. And we're going to go ahead and do the next one now. One thing I will say though, even if you don't get 30 newtons, see it's beeping now also. If you don't get 30 and you have multiple implants splinted together, it's not the end of the world. If it was a freestanding tooth, then it would be a concern, more of a concern. But if you have 12 implants and 8 out of 12 have 30 Newton centimeters or more and the other 3 or 4 don't, it's not the end of the world. Open big. For some reason, this one didn't quite go exactly where I wanted it.
Did it start to spin?
It didn't catch the bone, so I'm going to finish up this one. I'm going to go back and take this other one back out. See, it's loose. So I'm going to reposition that one a little bit. The ridge is very thin here, and I'm just going to position it a little less palatally. Do you feel pain?
Mm-mm.
Now we've engaged the bone. But there's a little bit more buckle now, so the stent may not go on. So I'm going to have to adjust that position just a little bit. With my ratchet wrench. So I'm going to go ahead and put the ratchet wrench on there, and we're going to bend that a little bit more palatally.
Dr. Shatkin?
Yes.
Have you ever had an implant break when you were bending them?
Nope. Don't jinx me, Jim.
I'm sure it won't.
Next one. We got one more 2-0.
No, number 4. Okay.
I'm doing number 5. Oh. 1325 is next. Okay, what's that?
It's a good idea to put the fingers on the
You can. The next implant's a 13 by 2.5. It's important for you to pay attention to the CT guide plan, which has all the implants listed by number. So read them over carefully so you know which implant to do next, because here we got a mixture of different implants based on the available bone. Some are fatter and shorter, some are long and thin.
If you had one that stopped, and then you increased it to 60, and it stopped again, would you cut the ball off, or would you turn it up higher?
I go all the way to 70. It just stopped right there. It's funny you should mention that. Stopped at 30, and we're going to go up to 60 now. Now it went in the rest of the way. And we're going to stop as soon as the implant driver touches the soft tissue. Okay, so we now have 5 implants in. I'm going to go ahead and try the bridge on. Make sure it still seats all the way to the gum line. Bite together. Check the bite. Make sure it's fitting all the way, and it looks perfect. Open. You doing good?
Mm-hmm.